Let's talk about those pesky vertical lines that some people get on their upper lip as they get older. Some people refer to these lines as smoker's lines or lipstick lines. Is it possible to get rid of these lines? Before we answer that question, let's go over some of the folds and lines that exist around the mouth area. Some of these lines and folds help define where the upper and lower lips start and end. The upper boundary of the upper lip is of course the base of the nose. When you look at its lateral boundary, that's going to be the nasolabial folds running along here. They help separate out the upper cutaneous lip from the cheek complex. As far as the lower lip, the separation between the lower cutaneous lip and the cheek is going to be the marionette line. The nasolabial fold and the marionette lines will start to become more prominent as the cheek complex descends with the aging process. The lower lip's boundary with the chin is at the mental crease, which is a more horizontally oriented line. And it's also possible to get a horizontal line forming somewhere along the upper cutaneous lip as well. Not everyone has that, but some people can develop a more static line that's there at rest, and some people have it only dynamically when they start to move their lips. Remember that all wrinkles form perpendicularly to the underlying muscle fibers. So in the mouth area, because the orbicularis oris is this circumferential muscle, when you look at the vertical lines of the upper lip, they're going to be perpendicular to that muscle. So if the fibers are running along horizontally, that's why on the skin surface you're going to see that as vertical lines running along that upper lip. These lines are much more common in women than they are in men, and that has to do with the thickness of the skin and also the hair that's present in men that tends to be protective against these types of lines. These lines develop with the aging process, and we can see them as early as our mid to late 30s. There are some predisposing factors to these lines, and that includes genetics, sun damage, smoking, alcohol, repetitive movements. Another predisposing factor is bone loss or the loss of dentition as we get older. As we lose that underlying structural support, the skin starts to feel those effects as well. And that's when you start to see more wrinkling develop and the philtrum itself getting longer. And many people find that these vertical lip lines are very difficult to hide, and sometimes your foundation or your lipstick can start to crawl into those lines, making it very difficult to apply that basic type of makeup. Now, when thinking about treatment of these vertical upper lip lines, the first and foremost thing is of course lifestyle modifications. And that includes avoiding smoking, because we know that smoking can accelerate the prominence of those lines, and also avoiding straws, because we know that that leads to that repetitive movement of those pursed lips, which can increase the appearance of those lines. It's just like with our facial expressions. If we're constantly doing this, we're going to get those vertical 11 lines forming in our glabellar area. It's difficult, but trying to retrain your face and those muscles of the face with the types of movements that you do is really important. Now let's talk about possible cosmetic treatments of these upper lip lines. First, of course, we have proper skincare, and this starts with using sunscreen, because reducing that sun damage is going to lead to healthier appearing skin with fewer wrinkles. Bringing moisture to the area can also be helpful, and that's done with things like moisturizers and HA serums. Those are great options for improving the hydration of that upper lip skin. And of course, there's retinoids that can help with increasing cell turnover and in turn leading to healthier appearing skin. As far as recommended AM and PM skincare routines, make sure to check out our video on that topic specifically. The next possible treatment is actually the use of oral collagen, and we have a dedicated YouTube video on that topic. But basically, people are finding that by consuming hydrolyzed collagen, they're able to improve the hydration of their skin and again reduce those wrinkles. There is mixed data on the use of oral collagen, but overall it appears to be a safe option that people can try to improve the quality of their skin, especially if people lack the proper intake of collagen in their diet. Next, you have Botox treatments. Now with Botox, you want to make sure that the quantity of Botox used is rather mild in the upper lip, because if you use too much of it, you might have difficulty eating or speaking with the use of this neurotoxin. So you have to be careful and not overdo the Botox in that area. And even small amounts can potentially lead to some functional deficits in certain people, and that of course will last for about 3 to 4 months unless you use Daxxify, in which case it might be lasting for half a year. So be careful about who you go to for this very technical injection. Next up is the use of filler. Now, the most commonly used filler is hyaluronic acid filler that can be used to help reduce those depressions that you see from these vertical lines. It's not my favorite option for patients with vertical lines because I feel like sometimes that filler placed so superficially can give you that Tyndall effect, and it can also lead to some additional filler migration in that area, and it can reduce the sharpness of the vermilion border. Also, by adding filler into the upper cutaneous lip, which is where the lines are, you can sometimes actually elongate the philtrum even more and stretch it out, and then people are unhappy with just the length of their philtrum. Another option for a slightly more permanent solution is going to be fat transfer from somewhere like the abdomen to the upper lip area. It's possible to inject that fat into the actual red lip, but it's also possible to put it into the cutaneous lip, and the fat can contain stem cells that will in turn rejuvenate some of those skin qualities, and that can be a very positive thing. Sometimes you can even use nano fat, which is a further reduced down purified version of fat, and that will contain primarily just the stem cells and not the actual fat cells, and that will bring less volume into the area and more of that regenerative quality. Microneedling is another option to help stimulate the regrowth of healthier skin, and some people are doing that at home with dermal rolling or stamping of the area. It's always best, I think, to get it done professionally, but that's again another option for improved circulation to the area and helping to in part resurface the skin in that area. Red light therapy we have a full video on, and that also has been shown to help reduce wrinkles. So applying that over the area, whether it's a very kind of focused device or a larger device, can also have some potential benefits for those upper lip lines. Choosing the proper device is kind of like the wild west right now when it comes to red light therapy, so try to go with reputable companies when you're choosing which device to potentially use for that area, but there is some data to support the use of red light for reducing wrinkles, and that can include the upper cutaneous lip. A few other devices that are sometimes used for this type of purpose are like a radio frequency type of device. There's also microcoring that can be used, and we have a dedicated video on the microcoring or Elocore technology and what that potentially can do and how it works. Also, some people are using the plasma pen on the upper cutaneous lip. Those tiny injuries to the skin surface can eventually lead to healthier looking skin. But for more definitive treatment of those upper cutaneous lip lines, I would suggest either going with laser resurfacing with an ablative type of laser like a CO2 or an erbium YAG that can get to the proper depth to actually do some good, because if you hit the area too lightly, you might not see change. You have to be deep enough with your laser to actually ignite enough cellular change so that you can get the proper resurfacing done and so that the skin heals in a more youthful type of way. But of course, the deeper you go with the laser, you have to also be careful of potential side effects, and that can include changing the pigmentation of the skin, different types of infections that are possible, bacterial, viral, fungal infections. So all those risks go up the deeper you go, but also your potential for improving the skin also goes up. So if you're going to do one of these deeper type of laser treatments, make sure you're going to an expert who really understands the laser technologies that they have at their disposal and that they're using the right laser for your skin type, because depending on your skin type, one laser might be safer than another. Another option are chemical peels, and we have a dedicated video on chemical peels, so please make sure to watch that one if you're curious. But basically, there are different strengths of those peels. There are ones that are more superficial and they just attack the most superficial layer of the skin, and then you have deeper ones like a phenol peel, for example, and that goes much deeper. But again, your risks go up the deeper you go. One thing to be on the lookout for is that as you start to resurface just the perioral area, your skin might look very different from the rest of the face. So sometimes it's advisable to actually treat other areas of the face as well, not just focus on those upper lip lines. But again, it depends on what really bothers you, and as long as you understand what the risks and benefits are, then you can make an informed decision. Some patients ask me, because of the nature of my practice, can a lip lift help with improving upper lip lines? I find that temporarily, maybe in the first few weeks, those lines will look less obvious because of just the swelling that takes place with surgery. But over time, those vertical lines come back. So the lip lift doesn't seem to resolve those lines, and it rarely improves them in the long term. But as you shorten the philtrum with a lip lift, you tend to take some attention away from that area so that the eye, when it catches the face, will look at other parts of the face instead of fixating on that long philtrum with those vertical lines. So that's one of the potential benefits of getting the lip lift if you have those vertical lines, but it's not meant to be the curative treatment for the lines. What I tell my patients who come in interested in a lip lift but also have these vertical upper lip lines is, let's do the lip lift and then wait at least 3 months, and at that point then you can get laser resurfacing for both the actual scar from the lip lift and those upper vertical lip lines. That to me is a great way to sequence the treatment. So the best option for dealing with these upper vertical lip lines is of course preventative, to never have them in the first place. But if you're going to have them, you're going to try to treat them, you have some options, both non-invasive and slightly more invasive, for trying to improve them. They're never going to completely go away, but you can get significant improvement if treated in the right hands.